The commonly prescribed SSRIs, selective serotonin reuptake inhibitors, for depression have some differences in their chemical structures, mechanisms of action, and potential side effects. Here are some general differences between the commonly prescribed SSRIs. Sertraline, Zoloft. Sertraline is a relatively short-acting SSRI and is often prescribed for depression, anxiety disorders, OCD, and PTSD, post-traumatic stress disorder. It may cause fewer side effects than some other SSRIs, but can cause gastrointestinal symptoms such as nausea and diarrhea in some patients. It may be preferred over other SSRIs in certain situations, including OCD. Zoloft has been shown to be particularly effective in treating OCD, and is approved by the FDA for this use. Panic disorder. Zoloft has been shown to be effective in reducing symptoms of panic disorder, including panic attacks and avoidance behaviors. Depression with anxiety symptoms. Zoloft may be preferred over other SSRIs for patients with depression and anxiety symptoms, as it has been shown to be effective in treating both conditions. Escitalopram, Lexapro. Escitalopram is a newer SSRI and is considered to have fewer side effects than some other SSRIs. It is often prescribed for depression and anxiety disorders. It may be preferred over other SSRIs in certain situations such as anxiety disorders. Lexapro has been shown to be particularly effective in treating certain anxiety disorders, such as generalized anxiety disorder, social anxiety disorder, and panic disorder. Fewer side effects. Lexapro is generally considered to have fewer side effects than other SSRIs, such as nausea and sexual side effects. Depression with insomnia. Lexapro has been shown to be effective in treating depression with insomnia, and may be preferred over other SSRIs for patients with this condition. Older adults. Lexapro may be preferred over other SSRIs for older adults, as it has a lower risk of drug interactions and may be less likely to cause certain side effects such as hyponatremia, low sodium levels in the blood. Fluoxetine, Prozac. Fluoxetine is a longer-acting SSRI and is often prescribed for depression, OCD, and bulimia nervosa. It has a longer half-life than other SSRIs, meaning it stays in the body for a longer period of time, which can make it easier to manage for some patients. It can also cause more activation or agitation side effects than other SSRIs. It may be preferred over other SSRIs in certain situations, including bulimia nervosa. Prozac is the only SSRI that is FDA approved for the treatment of bulimia nervosa, and has been shown to be effective in reducing binge eating and purging behaviors. Long half-life. Prozac has a longer half-life than most other SSRIs, meaning it stays in the body longer and may be easier to manage in terms of dosing and reducing the risk of withdrawal symptoms. Depression with fatigue. Prozac may be preferred over other SSRIs for patients with depression and fatigue, as it has been shown to have an energizing effect. Children and adolescents. Prozac is the only SSRI that is FDA approved for the treatment of depression in children and adolescents, and has been shown to be effective in reducing symptoms in this population. Paroxetine, Paxil. Paroxetine is an SSRI that is often prescribed for depression, anxiety disorders, and PTSD. It has a shorter half-life than some other SSRIs, which can make it more difficult to taper off, and can cause more anticholinergic side effects such as dry mouth and constipation. Paxil, Paroxetine, is an SSRI, selective serotonin reuptake inhibitor, that is often prescribed for depression, anxiety disorders, and OCD, obsessive-compulsive disorder. It may be preferred over other SSRIs in certain situations. Generalized anxiety disorder. Paxil has been shown to be particularly effective in treating general anxiety disorder, and is FDA approved for this use. Social anxiety disorder. Paxil has been shown to be effective in reducing symptoms of social anxiety disorder, including social anxiety and avoidance behaviors. PTSD, post-traumatic stress disorder. Paxil has been shown to be effective in reducing symptoms of PTSD, including intrusive thoughts and avoidance behaviors. Menopausal symptoms. Paxil may be preferred over other SSRIs for women experiencing menopausal symptoms such as hot flashes, as it has been shown to be effective in reducing the frequency and severity of these symptoms. It is important to note that individual responses to medications can vary widely, and a medication that works well for one person may not work as well for another. The choice of medication will depend on a patient's individual symptoms, medical history, and other factors, and should be made in consultation with a healthcare provider. RAM Recovery LLC offers comprehensive mental health services including therapy, medication, and residential treatment. To learn more about our services and schedule an appointment at one of our convenient Maryland locations, visit our website, https://www.ramrecovery.org, or give us a call today. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more helpful information. Call for an appointment.